fun.
The wellness workout program was kind of a team creation with the cancer program. Our inpatient unit, the nurses and myself, I'm a geriatric resource nurse, and saw the need in our patients who stay for long amounts of time. They became debilitated by being in bed too much, and we're looking to help fight fatigue and maintain strength.
We'll make it work.
Pretty much anybody on our unit that has a physician's order can come and do a half-hour mobility workout just to maintain strength and to maintain function while they're here. It's great for the body, but it's also great for the mind. We had a leukemic patient here who really did not feel well and was kind of in bed and probably was just really down mentally as well as physically. And it took everything in my powers and everything that I've learned to convince the patient that they should give it a try. And they actually became my biggest advocate, and over the time that they stayed, she tried it once, and I checked in with her afterwards, and I saw her in the hall later in the day, and we went from really her being kind of feeling like a patient to feeling much more empowered.
The training provides us with the tools and the resources really to help us take better care of our patients. I had a patient shortly after taking the class who was very hard of hearing, and I learned that in our training that we have assistive hearing devices that I didn't even know existed here at the hospital. And so I called down, and I knew where to get them from because you know, we were given that information, and we were able to pull from there and grab an assistive device for our patient, and it helped out tremendously. Prior to that, we were kind of writing on paper and scribbling back and forth, trying to communicate with her frantically. But because of the training, you know, I was able to get her a hearing aid device, and I was able to make communication a lot easier, and I think it enhanced her experience tremendously.
Now, those were the days when they still taught cursive writing, I bet, huh?
Yes.
For the patient, it's a more home-like, compassionate setting, where the patient's treated as an individual and needs are met on an individual basis. Recently, I saw a patient who was of Finnish descent, and my mom was born in Helsinki, Finland, so we had a connection immediately. We talked about the food and the customs and the language in Finland. It's a nice way to spend some free time and a gift that I can give to patients in need and to Hartford Hospital.